By popular demand, we are talking today about how to access health insurance really affordably, okay? Almost on any budget. So if you are making too much money for Medicaid but cannot afford health insurance, you are the reason that I put this video together for you. I have been doing lives, as you guys may or may not know, for a couple of weeks, and I realize the incredible need for this solution. So your solution is today in this video. If you cannot get Medicaid because you make too much, cannot afford traditional health insurance, your employer offers an unaffordable plan, or they don't offer a plan at all, this video is for you. So we are Monarch Agency Solutions. My name is Jennifer Cortes, and I'm going to hopefully share with you some very valuable information today, because as a wife, as a homeschool mama, I know firsthand things show up. Life just comes at us sometimes, gives us bumps and bruises that we did not plan for. That could be sicknesses, it could be broken bones, it could be specialists, it could be mental health care, it could be so many different things, which is why we need health insurance in place. We wouldn't want to ever drive a car without car insurance, because if you wreck the car, somebody gets hurt, right? Like, you can't go back and say, hey, Mr. Auto Insurance Company, can I please get a plan? And they're like, well, wait a minute, you already wrecked the car. You're playing Russian roulette with your health in the same way if you don't have insurance in place. But I do realize you're watching this because it's unaffordable for most people, right? 8 in 10 people who we sit with will tell us, I cannot afford health insurance, not in the marketplace, not at the carrier, not through my job. What do I do? And it's creating fear in a society when we have enough things to worry about. So I want to share with you this subsidy that is available right now. 8 in 10 people qualify for it. I'm going to explain to you why it was created, what it looks like for those who have access to it, how you can access it, and get this problem solved for your family. Okay, this subsidy is going to allow your monthly premiums that are currently unaffordable to look a little bit discounted, maybe low cost. For some people, I would say 4 in 10 that we talk to is no cost at all. Okay, and most people have no idea it's available. So if you have no idea, you're like the masses, because this has only been out for a couple months, right? What do I hear the most about why somebody does not have a health insurance policy is because it is too expensive. So what if that were no longer a problem? Second reason that I hear most commonly why somebody does not have a policy is pre-existing conditions, a diagnosis from the past, making their health insurance skyrocket through the roof for the monthly premiums. But what if everyone in your family was approved and that was regardless of their health? Would that change some things for you? What if you could see a doctor without having to pay up front to do so? Would that allow you to be able to take advantage of some more services than what you're accessing right now? Probably, right? And you've heard of the marketplace, you've heard of Obamacare, you've heard of the Affordable Care Act, also known as ACA, which is what we'll refer to it as moving forward in this video, okay? You probably also realize these are all the same thing, may or may not realize that. If you didn't, they are all the same thing. They're all available at healthcare.gov, but you probably go there and you look at the policies and say, oh my goodness, there's nothing affordable about that. That's because knowledge is power when it's applied. And yes, the subsidies are available through there, but you have to have the knowledge on how to access them. So that's what we're going to do today. Now, you may or may not have heard there's 2 big special enrollments or reasons why people are able to get the help now and get it for $0 out of pocket. This is a specialized niche. We have mastered that here, and we're going to share with you exactly what it is. Now, right now, today, there's 14.2 million policyholders that got policies and got these subsidies at for their healthcare.gov ACA policies. And you might be thinking, well, how come I didn't know about it? Well, don't feel bad, because actually right now there's 50 million people that qualify, but they didn't get the message out well enough, right? Like, here's the thing. Yes, the president has mentioned it on TV. Yes, it has been on the news. Yes, it has been on the internet, but people probably don't really understand or look past into it. They just go based on the assumption of the quotes that they did 3 years ago. And so anyway, they have no idea that it exists. There's about 50 million people in that space. My question is, are you one of them? And if so, I'm glad you're watching this video. So here's what happened. We have two things going on. First is called Medicaid unwinding. That is one of the special enrollment periods. You're probably like, what is that? So the public health emergency ended that we had been living under the guise of for the last 3 years or so, right? The whole pandemic situation that we have been experiencing. Anything that was set in place for that, well, that ended on March 31st. What this did for insurance, health insurance clients, is that it created a perfect storm for you to be able to get benefits that you couldn't before. So here's what created that. First of all, looking back, we had quarantine that's in our lifetime has not really happened, right? So this was a new thing to navigate. And when it happened, not only were people put in their homes, but all movement stopped for a little bit and businesses completely were shutting down. Now, during the same time that businesses were closing up for a little bit and shuttering their doors, people are not getting paid, but they're getting sick. Well, you can't pay a hospital bill with no income. So the government stepped in. You guys remember those $1,200 stimulus checks they were giving out for bills, right? Which people were grateful for. At the same time, though, they had to tackle the medical side of things. You got a massive amount of people going to a hospital that don't have jobs. And if they do, well, they're not getting paid for a little while. So they stepped in and gave Medicaid. Basically just about anybody that asked for it during that time. They gave out Medicaid for illness. Okay, that covered the hospital bills, it covered the doctor bills, it covered any ventilators, medications, specialists that came from the conditions. And so that number is upwards of 20 million people received Medicaid that in a normal world would not have. Okay, now fast forward to today. The public health emergencies ended. So Medicaid has to figure out, well, how do we reverse this now? We got 20 million people in addition to the normal Medicaid, which means we're looking, in the upwards of 70 million people probably have Medicaid right now. We got to reverse some of that. We got to get these people off. So they're going through an unwinding situation. What happens when this starts to unwind? Depends on the percentage of how many patients that a doctor is seeing that has Medicaid services, because it's not just 20 million people that have it. 20 million was the additional amount of people that most of didn't actually qualify. So is it 40%? Some will tell you 70%. That means doctors' offices, if all their patients are losing services, are going to have struggles to stay open. The other piece is you've got patients that have recently had surgeries or are receiving medical treatments for, chronic, critical, terminal conditions, and now they're being redetermined and need to have access to things. Mental health is an issue right now in our country as a whole for so many reasons. If you are a patient and you're going to lose access to the doctor that you need, well, that is a major problem. So there was a new stimulus package created because they realized that this is going to be unwinding. This process is going to be layered with potential situations that can cause other issues down the line, right? So they created this Medicaid transition program. So what does that look like is that it allows you to access the same plans, those who qualify for it, and it's most people, and I'm going to show you why. Most people do qualify for some form of a discount, meaning that they'll either pay a low cost, but if you're at the lower spectrum, you'll pay nothing at all to be able to go to the doctor. So that's the first special enrollment. Here's the second special enrollment that's happening. The average employee income is $15 an hour, okay? If you work 40 hours a week, and we already know a lot of these big companies will schedule you for 37.5 hours so that you just miss the cutoff for those benefits. But even if they do offer them to you and you can buy them, this is what it usually looks like. And this is an actual client of mine. $600 a week, $2,400 a month, $31,200. Now, this client actually makes about $40,000 because they're working side hustles, doing little side jobs, and sometimes getting some overtime. But their plan is $350. Now, they offer 3 different tiers, but the average plan that they're offering and most employers offer is $350. Now, if it's a mom and a dad and 2 kids, that's 58% of their income. So here's the second special enrollment. It's called Family Glitch. The Family Glitch says we realize that income and affordability of insurance, well, they don't line up. So the special enrollment is if the cost of insurance for you, your children, your spouse, any of your dependents is more than 9.2% of your income, then you can actually get it for $0. Now, when I sit down with my clients, I ask them, how much can you afford? How much that it doesn't break the bank? How much that you're not going to have a problem paying for your power bill or your water bill? Most people will tell me, and this client told me, okay, $275. So we're going to go with what this client said, but most people will tell me whatever the amount is. And then my question back to you will be, I probably can't do that with just one carrier, but what if I could get you the most benefits for the least amount of money, but it means you got to pay a couple of different places to make it that affordable for you, right? Because we're talking a $1,400 plan for $275. So work with me a little bit and I can probably make that work for you. So let's see what we were able to come up with. Now, I look at first, before I do anything, I look at the federal poverty level income limits. That's what the FPL here means. My client has 4 people in their households and they fall within the income limits here. Now, I'm actually going to quote them out at the 40,000 because he is working side jobs. He is bringing in some extra money with some bonuses and some overtime. So I go with worst case scenario to properly give, good expectations to my client. But you see, they fall here in this chart, and that means that they will qualify for a $0 monthly premium. Now, if you see at the top here, it's a 44-year-old male, a 44-year-old female. They have a 14-year-old, a 7-year-old, and I did it at 40,000 on the income. Okay, so this is what the results were. Now, if you make more money than that or less money than that, have different amount of family members in your home or people who need coverage, this may look a little differently. It may look the same, but this is what it was for this client. Okay, now they were able to get a $0 monthly premium. They also have a $0 deductible, which in my opinion is not the most important part of a policy. However, how much it costs you to go see a doctor is, okay? How much does it cost to get you your medications? It is. And in this particular case, you see $0 for both of those. It's an Aetna policy, which is owned by CVS. So, it's the largest network of doctors and hospitals in this country. You get a $0 minute clinic visits at CVS locations. It is a silver plan, so you're getting extra cost savings on hospital copays, things like that. And the out-of-pocket maximum, like total maximum, is $1,700, which that's not bad. I also do realize, though, $1,700 is a stretch for a family living paycheck to paycheck that might need a major surgery and a doctor saying, hey, pay that up front, before we do anything. So I have a solution for that too, which I'll show you in just a moment. Now, if you notice at the top, this changed a little bit because only mom and dad need vision insurance because the kids do not wear glasses of any sort. So the best plan that I found them was $17 a month with no waiting periods. They could literally buy it today and use it tomorrow. Dental insurance, same thing, buy it today, use it tomorrow. Okay, $53 a month and no waiting periods, which is great. They can go and get their cleanings done. If they get put in the hospital, I added a gap plan here that they'll get $200 a day for each day they're in there up to 21 days. But if you look at that middle arrow in the middle of the screen that says first hospital admission, they're going to get a check for $6,350. So is that going to pay off their $1,700 maximum out of pocket? Yes, it is. Will it pay some bills while they're healing up? Yes, it will, right? And that's $53 a month, okay? Now, if you're not getting health insurance through your job and you can't afford that, chances are you're not getting life insurance through there either. So I went ahead and I took the liberty, because this is a solution. If you are living paycheck to paycheck, you don't have an extra $20,000 lying around if somebody gets sick, critically, chronically, or terminally, or passes away before you were ready for that. Okay. So I wanted to see what that looked like for this family. And for the 44-year-old male, $1 million in coverage is $75.10 a month. For the second spouse, 44-year-old female, was $1 million for $59.78 a month. So not bad, right? Now, what I want to do is show you whether or not I hit the mark on their $275 budget. Now, mind you, before we sat down and had a conversation, they could not afford even just to go to the doctor, let alone have vision and dental and life insurance and all of that, right? So they gave me a $275 budget. And again, I was able to get them health insurance for $0, vision for $17, dental for $53, gap for $53, the 2 life insurance policies, and that's $257.09, leaving $17.91 left over every month. So my question is, how would this change your situation? Now, mind you, I put the ages and I put the income, so you'll see like just a true idea of what it would look like for a family. This is a client of mine. This is the actual policies that I did for them. Maybe we should sit down, or you should sit with one of our agents to see if we can do this for you as well. Because right now, there are $0 plans on the health side, which are available in most states. And if you can get your health insurance for low cost or no cost, then you can add in those other extras that you weren't able to get before you met us, right? Because our goal is to make sure that you and your family are taken care of, that we are able to provide cost-effective solutions that our clients are not getting anywhere else. They're not accessing this anywhere else, okay? So the only thing left for you to do now is take 10 minutes, sit down with an agent over the phone or on Zoom and get a free quote. Let's see what this would look like for you. If you send a text message with the words health bundle to 561-900-8082, we'll get a broker in your state to reach out and see what we can solve for you today. Thank you so much for watching, and I hope you make it a great day. Bye now.